Okay, thank you very much, Ali. That's very useful, practical information, and we hope that we won't have any technical glitches or anything for the next 2 hours. So my name is Kieran Moylan. I'm the Principal Officer in the Department of Rural and Community Development, and we're very delighted that you could all join us this afternoon. And we recognise as well that many of you have many other pressing issues as well at the moment, including your local responses to the Ukrainian crisis and so on. So we really appreciate that you've been able to join us this afternoon. We had invited for this webinar, and to allow some space for networking, discussion and feedback, we had put a limit of 4 participants per LCDC.
No, do you know what? I went in and
hold on a second. I'm just going to do some muting, and then I'll invite you to unmute, Kieran.
Yep. Yeah, okay, that's fine. So just to be clear then, as many of you will have attended our event in December last, and I suppose where we left off there was we had some slides at the end of the national information event about getting started and some of the key tasks that we felt were the first steps that needed to be taken around reviewing your previous LECP, about starting to prepare your socioeconomic profile, and about getting your advisory group established to oversee the process. So really what we intend to do today is to pick up on those points and to go into a little bit more detail on the key tasks that we would expect that you would be engaging in at this stage in the preparation of your LECP process. We will be concentrating today in particular on the socioeconomic profile and the socioeconomic statement. We also have input from one of your own chief officers, Dáithí, on the review of the previous LCP and maybe some guidance as to how he proposes that process is going to take place in his LCDC. And we'll just speak a little bit as well around the review of national programs and regional programs and strategies and how they can feed into your processes, and then some updates on the next number of webinars that we're going to host. So we've proposed for this phase 4 further webinars, and we'll give you some information about those and our objectives there. So I'm going to ask Lisa to do share screen now, and we hope that you'll find the event to be both informative and particularly helpful, in that we're here to help you. And we recognise that what you're undertaking this year is a very comprehensive and complex and time-consuming task, but we hope that the guidance that you'll get today from all of our speakers will be helpful to you all in getting the process moving successfully. So I'm now going to hand over to my colleague Lisa Keveney, who's going to present an overview of this stage in the LECP planning processes and some guidance on where you should be at in terms of the key planning tasks in accordance with the guidelines that were issued last November. So over to you, Lisa.
Thanks very much, Kieran. And I'm going to blame Kieran for taking some of my introduction there, so we have to revisit some of that. But look, I know some of you know me already, but I'm conscious we have a much wider group here today. So just to say, for those who don't know me, my name is Lisa Keveney, and I'm the Assistant Principal with the Community Policy Unit in the Department of Rural and Community Development. So as Kieran said, what I want to do here today is just give, I suppose, a little bit more guidance at a high level on some of the things we spoke about in that event back in December, your first steps and you're getting started, and break it down into those core elements and just tease them out a little bit more than we would have done previously. And just to say at the outset, I suppose, look, this was a difficult enough one to try and decide how to pitch, because I'm conscious not everyone is at the exact same stage here. And there's varying levels of experience within this room in terms of the people who have been here and who've done it before. And then I'm conscious there's newer people who this is very much new to them, maybe struggling to get to grips with how to get their head around it. So I'm going to try and bring all those people along, and hopefully there'll be something in here that will assist everyone along the way. So firstly, now this is something you would have seen before. These are the 6 developmental stages of your LECP. So not going into it in detail, but just to say what we're focusing on here today very much is that stage 1 preparation. So this is the very high level that's in the guidelines. What it's saying is, you know, your socioeconomic analysis, which leads to your socioeconomic statement and high level goals, and all of that being prepared by your advisory group, signed off by the SPC and the LCDC. So obviously that's the very high level, but we're just going to drill down into that a little bit to see where exactly you go to get to that point in terms of getting to your statement and your high level goals. So what I would say is there's those 3 key steps that Kieran mentioned. Firstly, the establishment of your advisory steering group, then your review of your existing LECP, and then the socio-economic analysis piece that we have other speakers who speak to much of that today. So in the first instance and around the advisory steering group, and again, this is something anyone who was there in December will have heard me speak to, but I think it's important just in terms of context to look at the purpose of that group again, and which is to assist in and advise on preparation, adoption, implementation and monitoring of the LECP. So you'll see there, this group is very much of relevance through the entire life cycle of the LECP, and to ensure an integrated plan, bringing the community and economic elements together. So this is really where this group plays a very vital role. Conscious that obviously there's statutory obligations on both the LCDC and the local authority through the SPC in relation to their individual elements. But there's also that statutory obligation there to look to having, insofar as possible, an integrated plan. And that's really where this group very much comes into play in the communication and the coordination in bringing those 2 sides together. And even just from the point of view of not duplication in terms of resources or efforts, that they're not both going out say to the same stakeholders are asking the same questions. So it's very much just so everyone knows what's going on and who's doing what. And now whilst the guidelines set out that framework purpose of the group and also the membership, the parameters of the membership, it is very much a local decision as to how you integrate this new group into your existing structures and that coordination element. You know, obviously you're the experts there in terms of how it will fit in and feed into the structures that are already there. Then just in terms of the membership of your group, so this is set out in significant enough detail on page 29 of the guidelines. But in short, what we're talking about here is your chief officer and at least 1 member of the LCDC, your director of service for economic development or enterprise, and at least 1 member of that SPC. And then after that, they're the core membership. Then it's any other person that both the LCDC and the SPC consider likely to make a significant contribution. So again, you're very much best placed to know who the key players are, who are the important people to have around the table there. And they can come from public sector organizations, private sector organizations. By way of example, look, you're probably going to be looking to someone with enterprise experience, someone with community development, social inclusion experience, things like that. Now, the guidelines don't set a maximum number or a guideline number in terms of membership. Again, I suppose you're walking a line there in terms of you want to have the right people at the table to move this along, but you don't want such an unwieldy large group that you can't actually get the work done. So there is a balance to be struck there. So then once you have your advisory group in place, then what I would say is, look, there's 4 key foundational elements to your LECP these are your building blocks everything will stem from these 4 pieces. So the first is the review of your current LECP. The second, your socio-economic analysis and statement. Then thirdly, outcome of extensive stakeholder consultation and co-design process. Now, I know today we're just focusing on stage 1, the preparatory stage, and stage 2 is an extensive consultation piece, but the consultation is relevant right through, including in the preparatory stage, and I will just mention that again shortly. And then the 4th piece, the 4th of your building blocks, is the local implementation of national programs and strategies. And if that's something I'll speak to again further on in the presentation. But just to say, all of your objectives, all the specific actions that you're going to have at the end of this process should be grounded in or informed by 1 or more of those 4 things. So they're all important in their own right, but there's also overlap there, and they very much should come together to inform that framework. Then the review of your current LECP is the first building block there. Just some key points to note, I suppose, and look, some of you will be sick of hearing me say this at this stage, but it's for you to review as you deem appropriate. There isn't a prescribed format here. The guidelines aren't prescriptive. The legislation isn't prescriptive. You very much have the pen here in terms of how you want to go about this review and what will work best for you. And what I would just say is to very much keep in mind the purpose of the review, which is to inform your new plan. It's not an evaluation of the existing plan, because the evaluation framework just isn't there to do that. And it isn't a quantitative exercise in terms of we achieved this and this, we didn't get to this, we didn't get to this. It is very much that you're looking to your new plan in reviewing your current one. It can be a desk-based review, and I would fully expect that most of them will be desk-based. Now, having said that, if somebody does want to bring somebody external in to do this review and they have the budget there set aside for it, look, no difficulty with that, but certainly there's no expectation that that would happen, and there's definitely no requirement. I suppose at a minimum level, what we would be expecting is that there would be a level of consultation or engagement with your stakeholders and partners, and that there would be a level of reflection. So I suppose the minimum ask here would be that you sit down around the table with the people who were involved in your existing LECP and have a look at it in a qualitative manner. You know, what worked, what didn't. So taking some learnings from it. And again, I suppose your focus and the desired outcomes from the review process is you want to be left with the objectives or the actions that need to be carried forward. And in many cases, particularly with your high level objectives, it may well be the case that a lot of them will be simply carried forward into your new LECP. There's a lot of long-term, very big pieces of work there that aren't going to be dealt with overnight. So we would expect a level of carry forward there, absolutely. Also, what needs to be prioritised in the new LECP, perhaps things that are there in your existing one, but you want to very much prioritise them in a way that they weren't in the previous one. That may be things perhaps around climate change and climate action that have become a priority in their intervening period. And then you also want to see what your learnings are. So again, what worked, what didn't work, what do we need to change a little bit? So all of this will feed into your high level goals and then your actions further down the line. Then just moving on to the socioeconomic analysis in the first place, and then your statement. Some key points here that I'd just like to get across, I suppose. In the first instance, no one expects hundreds of pages of data. You know, that's not what we're expecting at the end of this in terms of your statement. We absolutely know, look, you don't have either the time or the resources to do that, and it wouldn't be a good use of the resources that are there. So the focus really here in the analysis should be on identifying key trends for your local area. So what are you seeing coming through in the data in terms of are there local areas where there's something of concern coming through? You're seeing an increased need coming down the line in a particular area. You know, what is it you're seeing represented in that data in your local area? You also wanted to provide an evidence base for your high level goals, or more particularly your objectives. And you're also establishing baseline data for ongoing monitoring of outcomes and impacts. And that's an important piece also. So just to keep all that in your mind as you are looking at the data. And then just in terms of data sources, look, we have people coming after me who have much more of an expertise in the sources of data than I do, and I wouldn't claim to have. But what I would say, I suppose, is that we would like to see you use as wide a variety of sources as possible. be creative. You know, you'll hear about many different sources in a few minutes, but there are others, and there'll be ones you are aware of that none of the rest of us are. There's administrative data within your own local authorities that would be of use to you. And also, really importantly, your LCDC partners have knowledge and are such an important source here in terms of their own work. They'll have seen their own trends, they'll have done their own work, and there's really valuable knowledge to be gained by the other people around your table there. So I think it's just important not to forget that and to draw from that. And then just in terms of, I suppose, representing the data ultimately in your socioeconomic statement, what I would be saying is, and I think this is probably learning that has been taken by many people from the statements last time round, is to consider how you can represent the data and the trends in a visual format that's easily accessible, and also summarizing the key messages from the data from your particular area. So again, it's moving away from just the pages and pages of raw data and actually extracting what it means for you locally and how you can use that going forward. And you want a statement that you can use in meetings, use wherever you need it going forward. And this is what we've based our plans on. And that's just that extra piece of backup for you there. Okay, so you have your group in place, you have your review done, and you've done your socioeconomic analysis. How do you get to your statement and your high level goals, which is what you want at the end of stage one of the process? So you're building on the 4 foundational elements that have already been referred to. So what are you looking to achieve? You're looking for the key social and economic issues in your particular area. What has the data told you those issues are? And you have the data, and you also have, look, you're the experts in your local area here, so you know some of this yourself, and then you just have the data to back up what you know there. Then what did the review of your existing LECP say? So that's going back to what's going to continue on into your new plan. What are you prioritizing? What are you going to do differently than you did the last time round? Then what are your stakeholders saying? So this is that element of co-design. And as I said, you know, in that review process of your existing plan, we would expect that there was consultation and engagement with stakeholders there. So what came from that? And then there's the piece around consideration of the relevant national, regional strategies and policies, which is that final really important foundational element. So with regard to that, what I would say just in the first instance, this is something we will touch on in the next 3 webinars that we have planned. So on the economic enterprise, the community social, and the environment and climate change. But just, I suppose, at this stage, what I want to say is there is a list in I think it's Appendix 6 of our guidelines. We did come up with a non-exhaustive list of possibly relevant national and regional strategies. And these, and together with all the other strategies that you might be aware of, national, regional, and also you're going to have local level plans and strategies that will be of relevance. So these are all setting a policy direction, but I suppose to narrow it down, there's 1 or 2 things are going to arise here on foot of or under each of these strategies. You'll either have an obligation to do something, or there are opportunities for your area within that plan that you need to harness. And to be honest, there's an exercise to be done there in terms of working out which of the strategies and policies and programs are of relevance, either because they are imposing an obligation on you that you're going to have to filter into your LECP, or because there are opportunities there that you really want to harness and you need to take advantage of in your LECP and your implementation plans. So we will look at that a little bit in terms of how you can do that in the workshops going forward. I suppose in one way of looking at it, it may be an exercise in simply listing the strategies that you're aware of, what the objectives of the strategies are, and then looking at your own area in terms of what is its relevance to ourselves here, either in terms of an obligation or an opportunity, and how are we proposing to include that within our framework and policy. And obviously the obligations and the opportunities, they'll vary very much between all your areas. There are some national strategies that will be of relevance right across the board, things like the Climate Action Plan. There are things that will only be of relevance to a small number of areas, things such as Just Transition Fund and the Peace Plus programme, which will only be of relevance to the small number of border counties. And then there will be your regional and your national, or your regional and your local strategies that have more of an impact for you and that will have to be considered. Then again, something you've seen from me before, and this is something I just want to put up. These are the 6 cross-cutting priorities, or the horizontal principles of the LECP process. So they're just things to keep in your mind at all stages. That as you work through the process, these are the 6 things that really everything needs to be proofed against, and everything needs to be viewed under these filters. So they're just important for that perspective. So sustainability, including climate change, equality, including gender equality, poverty, rurality, age, and disability. So they're the 6 things to keep in mind. And then finally, just to touch on the forthcoming events that we will have mentioned before. So this is the first webinar. The second one is going to focus on economy and infrastructure. So it is still a tentative date. We will confirm it as soon as we can, but it's more than likely Wednesday, the 27th of April in the afternoon. So similar to this session, but we'll confirm that as soon as we can. We then have, it's not one of the 4 webinars that we've previously advised you of, but we do have a national event as part of a joint accounts funds project we are working on for the engagement of marginalised communities. So that will be open to all areas, and that's penciled in for Wednesday, the 4th of May. And then the final 2 webinars that we would have previously advised you on climate action and the environment, and then the community one, they will follow shortly thereafter, but before the end of May. So maybe 1 week after another, or possibly with a week's gap towards the end of May. But again, we'll confirm those as soon as we possibly can. And now, apologies if I've run over time there, but hopefully there was some useful information in there, and I'll just hand back over to Kieran now. So thank you, everybody.
I'll just invite you to unmute, Kieran.
Thanks, Lisa. And I hope that for those of you who are new to this process, that it does set out for you fairly clearly in terms of where we should be at this stage in terms of key tasks and processes and the areas of work that you need to focus on. So maybe as John is just getting his screen share up and running, I'd just like to introduce John Daly, who's an economist with the Northern and Western Regional Assembly. And just by a little bit of context, I suppose, is that we would have expected in 2022, as this process was rolling out, that we would have starting to receive all of the detailed demographic data from the Census 21. But as you all know, Census 21 didn't go ahead, and its census night is now going to be the 3rd of April, I think, 2022. But to a certain extent, there has always been a very high reliance on demographic data in terms of setting socioeconomic profile. But it's important, I think, just in the 2 presentations you're going to get next, that you get a sense of the wide range of data that's available to you outside of the census data, and that's accessible to you. And both John and Dr. Kavanagh will share with you where all those if that information can be directly accessible to you, and where it's available down to the county level, which is the level at which you will need primarily to use it. So very pleased, John, and I hand to have you here, and I hand over to you now.
Thanks, Kieran, and assuming you can see my screen okay just before I begin.
Yes.
Yeah, great stuff. So yeah, thanks for the opportunity to speak here today, everyone. So my presentation is going to focus on the county socioeconomic indicators that will be available through the Regional Assembly's forthcoming Regional Development Monitor. And hopefully the county indicators that will be available through the Regional Development Monitor will be of assistance to you in developing the LECPs. And just to note, my name is John Daly, and I'm the economist of the Northern Western Regional Assembly, but I'm representing all 3 regional assemblies today. So the structure of the presentation is as follows. So section 1 will briefly outline the kind of the purpose of the Regional Development Monitor. Section 2 then will outline very briefly the structure of the actual Regional Development Monitor and what will it consist of. And in section 3 then will outline county socioeconomic indicators that we're going to use in the monitor. So the first section, as it says, focuses on the purpose of the monitor. So the overarching purpose of the Regional Development Monitor will be to use a series of socio-economic indicators to evaluate the rate of implementation of the 3 regional spatial and economic strategies, or as we refer to them as the RESAs, which you can see on the screen now. The development of the Regional Development Monitor will be aligned with a variety of regional policy objectives outlined within each of the RESAs. So, for example, Regional Policy Objective 10.4 of the RESAs of the Northwestern region, which is on the left-hand side, it notes that it's an objective to carry out a review and update of baseline data for monitoring and reporting in implementing the strategy. And similar types of regional policy objectives have been outlined in the RESAs of the Southern region and the Eastern Midland region as well. Hence, the purpose of the Regional Development Monitor is essentially to monitor these statutory documents and to assist regional, national and local stakeholders. And then, as I said, section 2 then, I'm going to briefly outline the actual structure of the Regional Development Monitor. So the monitor itself is essentially an online data platform that will monitor social and economic indicators that will be key to kind of implementing and monitoring the implementation of 3 RESAs on an annual basis. The Regional Development Monitor itself will be available online 24/7. It will be a shared service across 3 regional assemblies. It will be free to the public, and it will be updated throughout the year and be linked to the websites of each of the 3 regional assemblies. And in total, about 60 socioeconomic indicators have been included in the Regional Development Monitor. And these socioeconomic indicators have been categorized into 3 overarching themes that I'm going to speak about shortly in the next slide. And the contract to develop the Regional Development Monitor has been awarded to AERO, which are based in Maynooth University. Now, based on the work of a cross-regional assembly working group, our choice of appropriate socioeconomic indicators are essentially categorized in 3 overarching themes. Firstly, placemaking, which essentially focuses on indicators related to quality of life. Secondly, climate action, which essentially focuses on obviously environmental indicators oriented ones. And then thirdly, economic development, which essentially focuses on economic indicators related to each region's economy. Furthermore, for the indicators that would be listed under the 3 themes, it was agreed by the working group that the vast majority of indicators must meet the following 3 principles, which you can see at the bottom of the screen there. So firstly, the data has to be from a reliable source, so like say the CSO, NTA, EPA. Secondly, the data can be updated on an annual basis, which allows for obviously annual evaluations and examinations of trends over time outside of the census. And then thirdly, data is as up to date as reasonably as possible. And it should be noted as well that the monitor will include obviously county socioeconomic indicators and CSO defined settlements, but also indicators that are unfortunately only available at a NUTS 2 and NUTS 3 regional level. And furthermore, generally speaking, the data will be examined over a 5-year time series, but that there is exceptions to that rule. And just
We've just lost you for a moment, John. I believe that's the case. Kieran, could you confirm? Have you also no longer hearing? Oh, there we are. Okay.
Sorry. So instead of tabs such as say vaccinations and ICU hospital, which is you can see at the top of the page there, you'll have say the 3 teams of placemaking, climate action, and economic development, with the appropriate indicators and graphics included within these tabs for each of the 3 regional assembly areas and their counties and settlements, since obviously it will be a shared service. And here are some of the kind of types of infographics and maps that will be available, through AERO's GeoHive, and will be available for the socioeconomic indicators that will be presented in the Regional Development Monitor. And again, upon completion, this will be available obviously to all stakeholders online 24/7, and it's expected that the Regional Development Monitor will be completed by the end of Q2 2022. And finally, then section 3, we're actually going to go specifically into some of the county socioeconomic indicators that will be available in the Regional Development Monitor. And it's important to note again that this information on these slides only includes the county data in the monitor and not the other indicators that are available only at the NUTS 2 and NUTS 3 regional level. And the selection of this county data is based on the fact, obviously, that it's from a reliable source, It's available on an annual basis and is as up to date as reasonably possible. And we have a number of county socioeconomic indicators that will measure the implementation of the recess in terms of placemaking, with these indicators generally focusing on housing, health, education, tourism, and the arts. So in terms of county data, the Regional Development Monitor will show housing completions, say both in terms of the number of completions and composition of those completions. It show the number of commencements and the number of planning permissions by county, all of which is available through the CSO. Will display CSO property transactions and household house prices by county. Using geodirectory data, the monitor will show residential and commercial vacancies by county and CSO defined settlements, and also residential densities by CSO defined settlements. Using data from the Department of Housing, the monitor will show the number of social housing units delivered or built by county and the number of people receiving housing assistance support such as HAC and RAS. Using data from the CSO and the Central Bank of Ireland, the assemblies will also develop first-time buyer affordability and renter affordability metrics by county and settlements, specifically looking at average mortgage repayment to net income ratios and average rent to net income ratios in these geographical areas. While the monitor will also track the number of people on a county basis that are classified as homeless using data from the Department of Housing. Moving beyond housing, the Regional Development Monitor in terms of placemaking will also show, say, HSE services in terms of GP services, hospital services, pharmacy services, dental practices, healthcare centres and nursing homes using county data from the HSE. The monitor will show the average classroom size in terms of primary schools by county and the average secondary school size by county using CSO data. Moving on to tourism, and by using Fáilte Ireland data, the monitor will show the number of visitors to specific cultural assets for tourist sites, both that are fee-paying and non-fee-paying. And using data from NOAC, the monitor will also display, say, library service usage and the degree of litter by county, while the monitor will also display the number of commercial units involved in the artistic community by county. And this will be achieved using geodirectory data. That's essentially the best proxy we had in terms of the artistic community in that regard on a county basis. Moving on to the second team of the Regional Development Monitor, which is climate action. The monitor will also show boil notices and water restrictions by county, with these indicators providing a proxy to water quality and will be provided by the EPA. The monitor will show wastewater capacity in terms of surplus and deficit by county and by CSO defined settlements using data from Irish Water, and it will show drinking water compliance in private schemes using county data from NOAC. In terms of transport, the monitor will also display the level of traffic by roads in each county using data from TII or Transport Infrastructure Ireland. And furthermore, it will display the level of sales in terms of electric vehicles and hybrids using data from the CSO. And it will display the number of public EV charge points by county using data from the ESB. Other county socioeconomic indicators that will be monitored and that will focus on climate action and that will be in the Regional Development Monitor, say, range from, say, wind energy capacity by county, the number of wind farms by county, and the monetary contribution of wind farms to commercial rates of local authorities, all of which would be provided by Wind Energy Ireland. The Regional Development Monitor will also show the main space heating fuel for domestic and non-domestic buildings on a county basis, which is available through CSO. And it will also display the building energy ratings for domestic and non-domestic buildings on a county basis, again, which is available through the CSO. And moving on to the third team of the monitor, which is economic development. The monitor will show, say, for example, disposable income per capita, with and without landlord rent included, which is available on a county basis and is regarded by the CSO as the best indicator in capturing economic well-being on a county basis and on an annual basis. The monitor will show the level of commercial stock by county using data from geodirectory. It will display the level of jobs supported by, say, Enterprise Ireland, IDA, LEOs, and using data from institutions, from these institutions and NOAC. The monitor will show the number of multinational companies supported by the IDA and the number of client companies supported by Enterprise Ireland by county. It'll display the number of people on the live register by county using CSO data. And that will obviously include the COVID-19 supports if they are still required. And furthermore, it will show the number of further education beneficiaries by each education and training board, which is obviously not on the county basis, but it's close enough to the county boundaries. Other relevant socioeconomic indicators that will be in the monitor as well will focus on, say, for example, the number of third level enrollments by higher education institutes using higher education authority data, again, not on a county basis, but it's at a lower level and it's relevant in terms of certain counties, and number of SMEs in it by county and the number of people employed by those SMEs by county using data from the CSO. And the monitor will also examine the number of passenger numbers, commercial flights and freight carried by each of Ireland's airports, all of which again is available through the CSO. And while the monitor will also track the level of investment provided under the designated Project Ireland 2040 funds, namely the Urban Regeneration Development Fund, the Rural Regeneration Development Fund, the Climate Action Fund, and the Disruptive Technologies Innovation Fund, using data from the relevant departments that have been listed there. And furthermore, the monitor will also examine other sources of funding, such as the European Regional Development Funds, by ascertaining information from ourselves in the Assembly. So overall, I suppose the selection of these indicators across the three teams are based on the fact, again, that they are available on an annual basis, they are from reliable sources, and that they are as up to date as reasonably possible. And generally speaking, as I said, we're going to look at this over a 5-year time series, but there is exceptions to that rule. And in ideal circumstances, we would have far more county socioeconomic indicators than those that were presented on the previous slides. Although there are other indicators will be presented in the Regional Development Monitor, these indicators, which are on the screen now, they're only available on an annual basis on a NUTS 2 and NUTS 3 level, regional level, and not on a county level. And these indicators are available on a county level, but they're only available at the census, and they're outdated at this stage. So we wanted the Regional Development Monitor to be able to monitor up-to-date trends on a regular basis, allowing for the implementation of the three recesses to be monitored. And ideally, we would have more annual and up-to-date county figures, but we don't have the data at this moment, and we can only go with the indicators that were available. And some of these indicators are simply acting as proxies as well. And in this regard, it should be noted as well that the assemblies would have undertaken extensive research into the development of the monitor. We would have extensive stakeholder consultations with all the relevant data institutions, such as the CSO, the EPA, the NTA, TII, etc. And these county data sets were generally the best indicators that met the three principles that we adopted. Basically, that it's a reliable source, annual, and this is up to date as reasonable as possible. But nevertheless, there is a provision in the contract with Aero which allows us to include new indicators into the Regional Development Monitor whenever we wish, and ensuring we can include new indicators that come available and also that come available through the census, which I suspect we will be putting it as a one-off inclusion, as well as maybe an additional tab, but we just have to wait and see as the results come out. But much of the county data that we would have explored and received would have been obtained through the following institutions that I've just put on the screen there now. And you can see they range from everyone from, say, the CSO, the EPA, Dept of Housing, TII, NOAC, Geodirectory, very good, and IDA and Enterprise Ireland, just to name a few. But just to summarise, the monitor, again, as I said, it will be available online 24/7 and free of charge, and is expected to be live in the Q2 2022, with the view of assisting and guiding stakeholders. And obviously this will assist yourselves in the development, hopefully, of the LECPs. And thanks everyone for the opportunity to speak here, and hopefully the monitor will be of use to yourselves. I can't stay till the end as I have another meeting in about 10 minutes, but my email is there, and you can liaise with the department, or just drop me an email once you get the presentation slides. But thanks very much.
John, that's really helpful, and thank you very much for that very comprehensive presentation. There's been a few comments just coming in the chat box. Maybe we might just deal with them while you're here, if that's okay. So just one is in relation to availability, which you've clarified, but you have provided links to quite a lot of the data sources. So a lot of that data, people can access it now from the same source that you're accessing it. I presume that's correct, is it?
Yeah, so once that presentation is circulated to everyone here, the links is available, the relevant tables. And for the monitor itself, as I said, that will just simply be available, like I said, the CSO's website. You can just log on to the Regional Development Monitor when it is live, and that information you can download it as well. It's an Excel format as well, And you can also use the graphics that will be available, that will be developed and designed and maintained by Aero. So once it's live, it's like any publicly available website.
Just another query then, and I suppose this is important where you have maybe city areas or large urban settlement areas within a county local authority area, is in many cases that data will also be available down at the settlement level. I know you mentioned it once or twice, but it's probably not the case for all of the indicators.
No, but in the terms of, say, for example, geodirectory, for example, is a good source of information in terms of CISO defined settlements. So in that case, you'd have the 5 cities, obviously, in terms of for example, Dublin city and suburbs, in terms of the other 4 cities, along with the other CISO-defined towns, villages. So geodirectory in terms of, say, for example, commercial vacancies, residential densities, commercial stock, those kind of indicators would be available at a city level. That's not the case for all of them, but geodirectory tends to be one of those that is available. And other ones then, say, for example, are metrics in terms of first-time buyer affordability and renter affordability, that will be also available at the city level as well. But it tends to be a minority in terms of the indicators that are available for city levels on an annual basis. Okay, a query just come in there about some data sources not being very timely, and tourism is mentioned. And as it happens, I think one of your predecessors there in Ballahadreen, Adrian, is now in Fáilte, Ireland, crunching all those tourism numbers. How up to date are those data sets? Unfortunately, if I remember correctly, the key tourism facts, which is published by is the name of the publication by Fáilte, Ireland. There tends to be a lag of about 3 to 4 years actually. Usually, and I should have noted this in the presentation, there's actually some of those indicators why we do notice at an annual level. Some of them actually available at quarterly levels, like for example, the building energy ratings and say the completions. But in terms of the Fáilte Ireland, Fáilte Ireland is one of the indicator or the sources of indicators that is, there's quite a lag between now and when the latest available annual data set is, which is unfortunate, but that's just a reality. Yeah. Okay, and then I suppose and just to say, in terms of data, I suppose just 2 updates as well. I do know that the Department of Taoiseach is leading on a project to look at much more detail in terms of local area data. Now, I'm not sure where that project is at, but it certainly is a process that will be rolling out over the next year or so. And also to say that we have committed, working with the assemblies and others, once the Census 22 data starts to becoming available, to put together a very comprehensive set of data that will be available at least before the first 2-year review of the implementation plans, and to feed into reviews at that stage. So just to mark that, but we are in many senses, the key sub-county data is very much based on census local area data, and that's not available except for 2016 and previous censi, is the plural. So that's just a major inhibitor there, but we will be addressing that once the detail of Census 22 becomes available to everybody, and that's something we've committed to do. So I think that's covered the queries. If there's other outstanding queries, we'll certainly follow up with them. And John, thank you very much for being with us, and I appreciate you have to leave, but we will certainly be in touch with you again. Okay, thanks, John. So I now ask Dr. Paul Kavanagh maybe to take up screen share. And just to say that we're really delighted because in terms of the presentation of data sources, that we didn't want to seem to be emphasizing too much on the economic and sectoral data. We also see an important role for social and welfare and health related data. And again, as I mentioned, the Department of Taoiseach, they're also leading on a project to get far better measures of national well-being and comparative data on well-being. So this is an area I think that's going to become more important as a kind of aggregate measure of how we're doing, and maybe how different parts of the country or different categories of people in the country are doing in terms of health and well-being. So we're delighted that Dr. Paul Kavanagh from the Health Intelligence Unit has agreed to give an overview on the availability of data on health and well-being. So over to you, Paul.
That's great. Thanks very much, Kieran, and to Lisa as well for the invitation to speak to you this afternoon. So over the next 15 minutes or so, I just want to start with a few reflections from my perspective as a specialist working in public health medicine on the importance of the LECPs in terms of supporting health and well-being across the country. And then I'll step through some sources of information in terms of public health and well-being, which may be useful to you in drawing up the LECPs. So Great. Well, look, first of all, just in terms of the importance of them, as I said, I'm a specialist in public health medicine. I'm a medical doctor. I've worked clinically on the front line across our health services. I now work in health information, trying to support the development of strategic policies and plans around health. But look, I just want to really emphasize to people that in terms of the instruments that are available to you through the LECP process, you are really in the driving seat in terms of being able to influence and positively shape public health, both at a community level, at a regional level, and at an overall national level. And this is because, I know people will be familiar with this framework, we recognise that individual health and wellbeing and the health and wellbeing of communities and populations are widely influenced by a range of different factors across the physical, economic, social, political environment in which we live our lives. And through the LECPs, you'll have the opportunity to influence those factors, and as such then have a positive impact on people's health and well-being. And I think important for us to recognise as well that people's experience of the physical, economic, social, political environment in which they live their lives is very different depending on their socioeconomic position. And this figure here summarises some data from the Central Statistics Offices, which shows that people who are born in more deprived neighbourhoods across the country can expect to live shorter lives as a result of greater burden of ill health, premature mortality, disability than people who live in more affluent parts of our country. So again, just really emphasising to you the really critical role that you can play in terms of both influencing health and well-being, but also addressing health inequalities through your LECPs. And this slide here just summarizes the scale of impact that there is as a result of this wide socioeconomic gradient that there is experienced by the population in Ireland in terms of their health and well-being at the moment. This slide here really draws that connection for you, which I've set out over the last couple of slides, which is that through your LECPs, you really have a powerful role in terms of influencing these wider determinants of health, working upstream on the various different challenges that people face, and bringing those policies together with your understanding of communities. I'm very interested to hear reference to placemaking in the previous talk, really to position that in terms of the place where people live their lives over a number of years, and through these LECPs really take up a key leadership role in terms of shaping individual, community, national health and well-being. So really delighted to see health and well-being on the agenda in terms of the LECPs. And of course, I think you're probably ahead of us. This whole idea of trying to plan bottom up from the needs of local communities is something that is coming to the fore in terms of health planning through Sláinte care within the health services at the moment. And there's a big focus on population-based planning, moving towards the establishment of community health networks, towards the establishment of regional health areas within the health services as well. So I think we're really following from your lead in terms of recognizing the importance of starting your plans from thinking ground up about the needs of local communities. So just after having made those remarks then and really emphasizing to you the critical role that I see you playing through these LECPs in terms of influencing individual, community, population health and well-being, to talk a little bit about some of the sources of information that may be available to you to profile health and well-being and inform your LECPs. So I'll speak about these across 4 domains: population and determinants of health, health status, health service use, and then health service resources. So in terms of the first domain then, population and determinants. So for those of you who will be working with health service partners through LCDCs in terms of the development of your LECPs, those individuals will have access to the Health Atlas Ireland system, which is a system that we manage here within the Health Intelligence Unit where I work. So this is a system which has a number of different applications within it, one of which is Atlas Finder, which has embedded in it the census small area population statistics, and through that then access to building profiles of a range of different shaped communities. So I'll speak about that now, and I'll show you how that works. So we're able to profile populations at a number of different health service geographies. So community health networks, Sláinte care health community program areas, forthcoming regional health areas as well. We also have embedded within the system counties, local authorities as well, and very important for you to recognise the relationships that there will be between your geographies in terms of local authorities and the different HSE geographies. So all of that is at the disposal of your health service partners who will be working with you to develop these LECPs. We then, as I said, have a position behind that, the CSO small area population statistics. So through that, then you have access to data across the range of different CSO census themes, including importantly self-rated health, a really important aggregate measure in terms of how people rate their own health and well-being, which we know is important in and of itself in terms of how people perceive their health and well-being, but is also very important because it's a very key indicator in terms of the development of physical disease and premature mortality. So that theme is available to you in terms of informing your LECP development. We have information on deprivation, including the HP index. We have information on the number of people in different geographies, and all of that data then is available for people to export and to bring into other processes of policy development, including the LECPs. And just noting here that there will be some overlap between these data sources and the sorts of socioeconomic indicators which the previous speaker spoke about. And that's because, as I said at the start of my talk, we recognise that from a health and wellbeing perspective, while we're oftentimes responding to ill health and disease, actually health is very widely determined by the wide range of factors that you will have influence on through your LECPs. We have information within the system on HSE services. We also have information available on population projections, and what's different to our population projections versus those that are available through the CSO is that they are available for relevant HSE geographies. So we have these broken down by quite small areas, including, for example, community health networks, Launch Care Healthy Community Programme areas that they will be positioned within your local authorities for which you're developing LECPs. And then finally, and I'll speak to this shortly, we also have available data in this system on health and disease estimates. And finally, then the system has within it a number of different mapping tools. So it's possible to produce maps that profile this data spatially in lots of different ways. So I have an illustration of that in a moment. So again, just emphasizing to you that this tool will be available to your health partners that will be working with you in terms of development of these LECPs, and available to them through the Health Atlas Ireland platform, and particularly then the Health Atlas Finder application. And this slide here starts to illustrate the sort of data and the sort of profiles that will be available to them. So what I'm profiling here is population data for regional health areas, but there's an area selector button, as you can see within the screen there, and it's possible to select local authority areas, counties, and various different HSE geographies, and to output population information in lots of different ways. And that information then can be exported in different formats and brought into different policy and plan development processes. The data can be mapped. I made that reference already, and this slide here is showing you an illustration of population density for the population age 65 and over, and all of that then is positioned within a health service geography. So one of the key attributes of this system, and one of the key areas in which it can bring value to your LECP process, is that it has embedded within it the range of different health service geographies that will be positioned within a local authority area. So that will be relevant in terms of understanding the different relationships and partnerships that will be relevant in terms of your LECP. So moving on then to talk a little bit about health status indicators. So there are a range of different health status indicators, and these can be sourced from different places, including the Health Atlas Ireland system, which I've already profiled, but it will be necessary for your health partners to go to other sources as well to build up a complete picture of health status. And there are people within public health departments and within the health services, your partners in developing these LECPs, who will be available to you and will have expertise in accessing and using these different systems. One of the points that I will note is that a lot of health status data is not available at a very small level geography. So some of the health status indicators come from sample surveys that are conducted nationally. So they wouldn't necessarily be explorable by small geographies. So that is a challenge. And then other health status indicators, like for example, mortality, they're available at higher level geographies, like for example, county. So there will be some challenges in terms of extrapolating from the available geography, which is coded on these different health status indicators, to building up a profile of the health status of populations relevant to your LECP. So just noting that as a challenge, but again, there'll be expertise in your health partners who'll be able to work through that with you. So this slide here is giving you an illustration of the CSO data hub, and that has available to within it then the mortality data, and that's available in lots of different ways. The same data is also available to your health partners through a system called the Public Health Information System that's available within public health departments. So they'll be able to bring that to the table. And I'm just noting here that there is some care required when drawing comparisons, particularly in terms of health indicators between different geographies. And there are particular techniques that are required, including age standardization, to ensure that you're drawing valid comparisons. It can be very easy to line up these health indicators across different geographies and inadvertently draw conclusions that there are different burdens of disease in different parts of the country, which from our perspective as public health professionals wouldn't necessarily be valid conclusions to draw, because they reflect compositional differences within the populations that need to be adjusted out if you're going to line up these indicators and draw comparisons. So again, this is where your health partners will come into play in terms of making sure that you have access to these health indicators, but critically that you also have access to the expertise necessary to mobilize them and ensure that you're drawing correct inferences in terms of what the data is saying. And this slide here then is showing you some population sample data. In particular, what I'm illustrating here is the Healthy Survey data, which within the Health Atlas Finder application that I illustrated previously, we have made available to people at various different health geographies within the health services. And through taking that sample-based survey and applying it to smaller populations, we are then able to produce estimates of the number of people with different health states, whether they're health risk factors, like for example, illustrating here, alcohol misuse, smoking, obesity, or whether it's different chronic diseases or different mental health needs. We have estimates of the burden of people that we can extrapolate will be living with these different conditions in various different geographies from national surveys, like for example, the Healthy Ireland survey. So that's available to people as well. Moving on then to talk about health service use. So again, we have a similar challenge here in terms of the geographic coding of routine health services data. So a lot of our routine health services data is coded to the service provider, not necessarily coded to the location of the individual who's accessing the service. So the data tends to be service centric rather than community or population centric. So that can be a challenge then in building up profiles of health service use for different communities that will be relevant in terms of your LECP development. But notwithstanding that, the data is still very useful, and there are workarounds in terms of that. So I'm just illustrating here then again for your health service partners who will be working with you on the LECP development. They can access, for example, the hospitalization data set, which is called HYPE, and we have a portal through which they can access that. We have an interactive front end on that, and they can produce various different counts in terms of the number of discharges that there will be for relevant communities across the country in terms of their use of health services, in this case, hospital services, and their use by different disease groups or their use by different population groups, for example, older people versus children, etc., etc. So this system is available to your health partners. And finally, then we do have data available in terms of health services resources, and much of that then is coded down to XY coordinates, so we can make that available available, and that's mappable then within the portal that we have available. So I'm just illustrating here, slightly busy map. We probably zoom this in and produce it at a lower level geography, but I'm just illustrating here then the geospatial distribution of health centres, mental health services, pharmacies across the south of the country. So again, this mapping infrastructure and these data in terms of how HSE services will be available to your health service partners, and they can bring that to the table in terms of the LECP development process. So that's a quick tour in terms of the health data that will be available across these 4 domains of population and determinants, across health status, across health service use, and across health service resources. And as I said, they are available to your health partners either predominantly through the Health Atlas Finder portal that we have available to people who work within the health services, or available through local systems, like for example, the Public Health Information System, or available through national portals, like for example, the CSO. And there will be individuals within the health services who will have experience and expertise in terms of accessing those sources, mobilizing them appropriately, and as I emphasized to you as well, making sure that they're bringing to the table the correct interpretative skills so that you're drawing correct conclusions in terms of the patterns of health and disease that may be observable through indicators that are profiled at a community level to inform your LECP development. So I'll leave things there, and very happy to take any comments or questions, Kieran, on that.
Okay, much appreciated, Paul, and that's been very helpful. And there's been a few questions there coming through on the chat box. I think you may have answered the first one there in terms of accessing the Health Atlas and so on. And look, we can follow up with maybe county level contacts at some stage in the future, just in case there's any confusion. But some of the sources you mentioned there are the health module within the CSO site, for example, which is accessible to everybody, as I understand.
Exactly. Yeah,
there's a question there which I suppose we were anticipating, and somebody asked it anyway, was, can someone not just give us all of this information anyway and just send it down to us in a big envelope? But and I suppose just, well, first of all, we don't have the resources to do that, and I think secondly, like as Lisa outlined in our presentation, the idea of the foundational elements, the socioeconomic data that's relevant to your LECP plan may be different in many respects to the socioeconomic data that another local authority might choose to use. And we also, as we had outlined in the earlier presentation, we want, these are national available sources, but what we do want to also emphasize very strongly is that you should be accessing local information from local LCDC stakeholders, state agencies, and so on locally, and also that there may be local studies, and for example, there may be research that's been carried out by one of the bodies in the area that also can be used to complement or to supplement that data. We also had mentioned the availability of administrative records, which your local enterprise office may have a lot of detail available to you. Your local sports partnership may have a lot of information. The County Childcare Committee may have information. If it's relevant to what you want to build on in terms of setting objectives and identifying specific actions. So it's not just a case of, somebody spends the next 6 months putting together a compendium of statistics for 31 or 2 or 3 LCDCs. It's very much that you need to draw upon and use the ones that are relevant to the plan that you want to put together. So we are certainly, it's not our intention to be prescriptive with a list of 60 different indicators that you must use. It's a case of, these are all the sources that are available, and we suggest that you draw on the ones that are most relevant to yourself. So I think, if that's okay, just a few, now that we've finished, we've had the 2 presentations, and to thank the 2 presenters again, just a few general points I'd make. In a previous role when I worked with the Northern and Western Regional Assemblies, I did have a role in reviewing the previous LECPs, and so would have had an opportunity to review the 9 local authority draft LECPs as part of a process of giving feedback, and it was also linked into the statutory requirement, which that they be consistent with the regional, spatial and economic plans, or what were then the regional planning guidelines. So just an experience from that experience, and I do recall in some cases where there was very substantial socioeconomic data reports provided along with the draft LECP, and in some cases I could see no relationship whatsoever And it was clear that the local authority had put enormous resources and time into producing a very, very detailed, right down to local area statistics, age cohorts, gender, over multiple intercensal periods. But it didn't seem to me that there was any great connection between what was produced in the socioeconomic report and what was actually in the strategy. So I suppose it reinforces the point that data is not information, that it needs to be translated, it needs to be interpreted. As simple as data is just a past participle in Latin. It just means whatever you're given. That's all data means. So it's not of use to your plan unless you interpret it and you present it in a way that can be interpreted and used by your stakeholders, that you can use at the meetings with the municipal district councils, the LCDC itself, the SPC committees. So, and I suppose in terms of making it useful, and just a few suggestions, which I'll send on afterwards with the slide presentations, is that, when you're doing a summary statement, the data must provide context. And it's important that it's interpreted correctly. So for example, it could be that your number of estimated overseas visitors has declined in a particular period, but it could well be that one major attraction closed at that time, and in fact overall the sector is doing quite well. So just to be clear that the information that you present is quite contextual. Second, I suppose you could also have a situation like in Longford where a facility like Centre Parks opens up and you've got a 1000% increase in your overseas visitor numbers, which again sets an important context. So the second thing I think is important to use comparisons and to use relevant comparisons. So you might find that your population growth is below the national average, but say you're one of the Midlands counties and it happens to be the highest of the 4 Midlands counties. So the comparison is very relevant there in drawing a conclusion on your data. I suppose the third point I'd make is that, where there's been changes and trends, that maybe the causes of those need to be stated. And that's probably only something that you'll get from consulting with the relevant agencies or bodies in your LCDC area. I suppose the fourth area is around trends, and a positive trend isn't always necessarily a good thing. It could be a positive trend that's slowing down. It could be a trend that's negative, but is actually it's beginning to turn in your favor. So just be careful about using trends that just because they're currently positive or negative, you need to see if you can interpret those. It's been mentioned already around spatial focus where possible. And again, we appreciate that there just are some data sources that are not of it, just don't exist at a sub-county level, and unless you're willing to put resources into trying to gather that data in some way. But where it's possible to be specific. So it could be that the population of your local authority has risen, but maybe 50% of that is within 5 kilometers of your county town or something like that. So that's an important, spatial consideration. And finally, then, just to pick up on the point in Lisa's slide as well around the horizontal principles, in assessing the data and deciding which data you want to include in your assessment, have regard to the horizontal principles where it's relevant to do so. So, for example, your sports partnership might produce really good data saying that participation in sports and exercise is increased in your county. But it may well be that it hasn't increased, for example, for teenage girls, where there's a very high dropout rate from participation in team sports or something like that. So that's, so just to say that the production of vast quantities of data in itself is of no use really in terms of informing your process unless you actually summarize it. And I would suggest that it should be possible to summarize it in a way that it could be presented in 15 to 20 minutes in a PowerPoint presentation in terms of the key messages that this data is giving you. And then that it's clear from a communication point of view what your profile is and what the issues are. So we'll send on those kind of points later, just in terms of making good use of the data that's available to you. So just with that time moving on, I just want to pass on now to Dáithí, Downey, who's the Chief Officer in Dublin City. LCDC. Dáithí, you're very welcome. And we had asked for volunteers, somebody just to share their own thoughts about the LECP review, which is one of the other foundational elements. And Dáithí kindly volunteered. So Dáithí, I'm going to hand over to you now, and thank you for joining us.
Good afternoon, everyone. Hope you can hear me okay. Quick thumbs up from Ali if that's working. Yeah, good. Okay, thank you. Delighted to be the volunteer today. And thank you very much for the opportunity just to talk a little bit about what we're doing and how we're trying to approach this You've heard a lot this morning about data and data sources and other contents. What I want to talk to you about will include that, but mostly really giving just a quick overview as to where Dublin has got to in terms of reviewing our plan and where we've got to in terms of our advisory group and how we intend to proceed, if that makes sense. So all of this will be circulated afterwards. So apologies for the text heavy content, but just to get it established. The inaugural LECP in Dublin actually went as far as developing an annual action plan for the years 2016 to approximately 2019. And across those action plans, we have somewhere north of 550 actions which had been commenced and undertaken. And we're able to rely on that as a framework for an evidential review of the status of those actions, whether they were completed in full or in part, how they achieved the sought after outcomes or outputs, depending on what was specified. And we're relying on administrative data to do this. The administrative data we're relying on effectively are the contemporaneous accounts, true minutes, and other forms of reports that were all made public, as well as annual reviews to re-establish the follow-on annual plans. But importantly, we're not overlooking the opportunity to identify key informants involved in that process. So it's a bit of detective work going back, trying to confirm who was involved, and hopefully they're still willing to talk about their experience and bring forward an insight and help us ascertain a better form of understanding and knowledge. We're very concerned that a lot of people have talked about the shift, the narrative shift, to put it very broadly and quite benignly, that emerges from late 2019 to do with some adjustments on policy actually and the role of the LECP, and then very suddenly and very, very dramatically and continuingly so from early 2020 with the onset of the COVID-19 pandemic. And the disruption in that space is I suppose, cannot be underestimated, but it's important in some way to identify the key dynamics around that disruption, because it quickly shifted and redirected resources towards the community call responses and other forms of response towards COVID-19. In our early discussions with people, one of the reflections that people have brought forward is that the ability to switch quickly and effectively into a community response under COVID-19 to the COVID-19 was a reflection of the strength of integration between organisations within the LECP. Now it's not complete. It's somewhat, there are still gaps in the scale and scope of that response that others would argue weren't as effective. But overall, it's taken as a sign that there is a great value towards the process of the LECP. And from that discussion, we've kind of got into a really open learning kind of reflection with dedicated meetings in the LCDC, engaging with people and listening to their insight, to their opinion, to their reflection. A lot is coming out of that because we're unpacking quite a lot, really. Not all of it is immediately relevant to the now, but quite a lot of it is very vital to understand as we proceed. And we're picking up quite a lot of insights in a qualitative sense. So we're not talking about hard empirical data or primary data sources originating through survey or through larger scale data collection, such as the CSO or indeed the Health Service Atlas, which is an excellent resource, by the way. It's great to see geography back in many ways. So the gems that we are identifying there, when we've got this little phrase we've got going on about a gem analysis, it's often the times that a number of people share a view, an insight on something which can contribute to a very rounded understanding. And that's kind of a gem of knowledge, qualitative, almost, you could say, almost ethnographic type of understanding. That type of understanding is very important to us in the preparation of this stage of the LECP, because it's going to help us guide what empirical data we want to go after. to help us robustly describe the insights that are coming from that conversation. And that's quite the approach thus far, with both members on the LCDC and the SPC and in the advisory group. So just to switch into the details of the advisory group, we undertook an expression of interest from both the LCDC and members of the Enterprise, the Economic Development Enterprise, SPC and DCC. We began that in late last year and gave it a couple of, I think, 6 weeks or 8 weeks, and encouraged people to think about how they might participate. We wanted people to make themselves available for all sorts of reasons, but particularly in order to capture the competencies that we want to be able to reflect on the advisory group, make sure it's as effectively balanced as we can achieve in terms of both gender and representation, spatially as well as topically and thematically. So in the end, after a number of expressions of interest, more than the places that we agreed that would be available, which was great to see, our two chairs of both LCDC and the Economic and Development Enterprise Committee confirmed a membership at 10, would sit at 10, and that they would adopt, as an interim anyhow, a joint chairing mechanism. So at least one of them will be available to chair each advisory group meeting, if not both in attendance. We also have the benefit of expressions of interest to start a short list of substitutes, and we think that's an important thing to try and do as well, so people can step in and out of a role if required over the process of this next year and a bit. And indeed, there might be a buddy system or a way of just sharing information with people on the advisory group, so somebody can represent a person and that doesn't interrupt the planning. We're all very time poor, and even with the benefits of this technology that we're all learning to use very well and very reliant on, we're increasingly tasked as a result. But we do need to be taking the chance to learn together, and we're thinking the substitutes and corresponding with the substitutes is important. We have to agree certain terms and certain rules around that because there are confidentiality matters as well. But generally speaking, that's a well-received agreement amongst the members. So that there is the list 1 to 10 of the membership. You'll see both the chairs from the respective committees, a number of chief executives, a number of representatives from both committees, a number of academics and specialists and business partners. We're quite fortunate that we've had this success in establishing what we think is a pretty robust advisory group membership. So what's next on that really is, yeah, there's 2 more stages just to quickly go through. I don't want to spend a huge amount of time on this, with probably questions and answers will elucidate more. We had to get together internally within Dublin City Council to try and sit down and work through the various issues here about before, how are we going to approach not only the LECP in terms of the overall process, but how are we going to establish the advisory group, its terms of reference, and what are we going to do to ensure we have an appropriate budget, fund and staff and resource to support the development of the LECP and the advisory group. And I'm delighted to say we haven't concluded that discussion because it's going to be an ongoing discussion, but it's really important to get that underway within your senior management team and to make it something that's clearly required and upfront and center. We've also talked a lot about how we might start some form of rapid evidence review in order to obviously contribute to that review of the initial plan to 2016 to 2021, so I should say, but also to help inform and shape the new high-level themes and goals that we'll be undertaking. And as part of that discussion, we've been keen to harness the energy and to leverage the expertise and the energy of the advisory group and to get them as knowledge brokers effectively to feed into that process and that thinking. So that allowed us to go forward to our first advisory group meeting, which happened on the 15th of March. And at that, we had, broadly speaking, the 4 agenda items under consideration. We really needed to be able to be clear about what context and explanation of an LCP is for all the members, what it does, what it should be, and how it's framed within the national and regional policy. In many ways, the guidelines give you quite a lot of that information, but there may be some specifics that you might want to frame. There are for Dublin, for example, and there's certainly going to be variation across different colleagues in local government on that one. Up front and centre with the advisory group about the terms of reference, guidance and governance to do with how the individual group member might contribute, for example, if there's a possibility of a collaboration, or indeed, as this was mentioned, a co-production in research or some form of engagement or consultation later in the year, that needs to be brought out as quickly as possible, and people need to be able to put their assets on the table as much as they can. And then we can, obviously talk to the very pragmatic issues of the tasks, the timelines, the schedule of meetings, the development process, which then, gets people into a planning state of mind and gets us closer to understanding context issues and planning for the socioeconomic profile and the consultation process. We had a very vigorous, blended, hybrid, I think was the word, meeting, which was another way of learning. But we are preparing a report on the basis of that engagement. The report will re-articulate, hopefully, in language that's clear to everyone now in the advice group, what the understanding is here that we've both achieved in the lifetime of the previous report, but also where we're going next. And I mentioned at the beginning that there was quite a lot of opinion about the importance of the collaborative approach between economic and community development, and also a number of the integrated, joined up tasks. And there's a sentiment emerging that really it's in the core intersection between both economic and community development that we're going to find the best value in the LECP, although that's just a point of discussion. How that eventually works out in terms of the balance of actions and high-level goals, etc., is a separate matter. We have agreed and adopted the terms of reference in draft form. It'll be finalised at our next meeting. And we have agreement on a proposed work plan and timelines, and again, they will be finalised. The discussion about resources and codependencies within the advisory group is ongoing, and we do need to keep returning to this. We're going to be relying on our advisory group, as I mentioned in this role, of knowledge brokers, and we would be hopeful to be able to identify within our advisory group opportunities to engage with expertise, whether it's institutional or individual, and that expertise can inform and help develop and specify the socioeconomic statement, but also particularly the high-level goals. And in that, we're identifying a number of themes that we think will become part of the high-level goals. So to finish with, the main thing at the moment that people are most concerned about is whether the number of high-level goals gets reduced, gets consolidated down into a much more robust articulation of 4, maybe 5 or 6, no more than that at the minute, key thematic issues. And that within that context will become much more focused on the competencies of local government in terms of its collaboration with other institutions, but primarily to ensure that the high-level goals are articulated under areas where local government has statutory competency and is funded to provide services. Because a lot of people are concerned with the possible overreach and the possibilities of not having the same level of commitment to different areas of the plan if we fail to secure those resources. So that's where we're at. Thank you for your time.
Okay, thank you very much, Dáithí. That's been very useful, and I think it'll be helpful to people in when they're themselves moving into different stages of the processes you have in order to set their kind of timeframes and the roles and so on. And that's been very, very useful to share that. And we would hope in future webinars as well to have opportunities for sharing across different LCDC experiences. So there was just 2 quick comments on the chat I'll pick up on. I don't want to spend huge amount of time on them. One is around qualitative data in terms of maybe surveys, people's experience, feedback, descriptions, and so on. No difficulty at all with that being included in the socioeconomic profile. And to a certain extent, the feedback from your stakeholder consultation is in itself maybe possibly a form of qualitative research, in that it's about people's perceptions, experiences, reviews of things themselves that went well, went badly, things that are needed in your county or city or parts of it. So no difficulty at all with qualitative type information being in the profile. There's also a suggestion around sharing resources around and synopses of various national plans and strategies. I mean, there's an indicative list in the guidelines already that in terms of a synopsis, I'm not sure that that's of huge value. I suppose really what's of value is that the opportunities that it might present to your local authority area, and there will be lots of plans and strategies that mightn't be relevant at all. So, we have, the likes of the Peace Programme at 6 counties, there's 10 counties or 11 that have Gaeltacht areas, there's some have offshore islands. There's strategies related to all of those areas. There are programs and plans at county level and at regional level that will only be relevant to a small number. So the key piece of work really is to identify the opportunities and maybe it's the obligations that those plans or programs or strategies have for your individual county. So I'm not sure the value of somebody going off and writing up a synopsis because it really is important that the direction that comes from those is specific to your plan and is specific to your local authority area. But there certainly is an indicative list of what those plans and programs is in the guidelines that's available to everybody, and certainly no problem at all with local authorities sharing what they might have done in that area and sharing ideas and so on. And again, we might discuss with the Chief Officer Network what's the way of doing that and ways of sharing resources. No problem with that at all. So maybe we can pick up on that. Okay, so now we move on to an opportunity for yourselves to network and to give us, to have time to reflect and to also feedback to us. So I'm going to hand over to Ali, who's just going to talk just a little around the logistics of this. So we'll have about 15 minutes. I know there's been a little bit of slippage on the time, so we'll have about 15 minutes in chat rooms and we'll come back in then. And I know, Ali, you have an innovative way as well then for people to feedback on that. So we're not going to do, death by feedback or anything like that. We're going to do it in a different, more innovative way. So over to you, Ali.
Great, thanks so much, Kieran. And yeah, we just thought it would be good to have a brief opportunity to connect, to respond to what you've been hearing, share with each other. And then, as Kieran said, we'll come back and it'd be great to hear from all of you in a written way. So I set those rooms up. Kieran, you were saying 15 minutes. I think that's the right amount of time given the time that we've got left. So you'll just find yourself in the rooms. If there's anything you need, there's a little button to ask for help and that'll alert me. Probably just introduce yourselves briefly. And then I think our plan was really just to ask you, for prompt, what you might want to discuss is just what are the opportunities you see from what you've heard today? What are the challenges that are coming up? Any other information you're looking for? So it's really just that. It's what's coming up for you after all you've heard, a chance to talk to peers and colleagues, and then we look forward to seeing you back here in the main room. So I'll open those rooms now and wishing you a great conversation.
So first of all, I suppose I just want to thank you all for your attendance. We had a great attendance and most people stayed till the end, so very much welcome that. I want to thank in particular our speakers, Lisa, also to thank my colleagues and particularly those in Lisa's team for organising the event, including Anne and Tina. Thanks for that, and also to thank you all for your engagement. Look, I suppose we're conscious as a department that we want to provide you with guidance and direction. We want to be supportive, but we certainly don't want to be prescriptive. And we very much want this to be your plan, your strategy, your vision, your actions that your partners are committing to implementing with you. And that you see the opportunities that might be becoming available to implement your plans through all the various national programs, quite a lot of which are coming through our own department, but lots of other departments and agencies as well. So, we want to just strike that balance and for yourselves, to define your information needs, to identify where you see the opportunities, the future direction that's agreed with all your partners, and so on. So we're very much willing to work with you and to provide a steer and signposting and support and so on. But I suppose what we're not going to be doing is gathering the data for you or direct.
So I think we maybe just lost Kieran for a moment, and perhaps I'll just, Lisa, if you're there, I might just bring you up as well, and maybe we could just finish those final remarks in case Kieran isn't able to join us just to end.
Yeah, sorry, my internet just went out for a second there. So
okay, great.
Look, I was just going to
back.
finish with that, but just as a reminder again, as Lisa presented, we have 4 further events, 3 very specific thematic events looking at 3 very important elements of your plans, and one then which is also a very important element from us as a department in terms of having proper community engagement and consultation in all of your plans and processes and how you might do that. So with that, I think I can close the event, and to thank you all, and just to confirm that we will be sending around all of the slides and presentations from today. So certainly that will be very helpful in following up on the various data sources and links and so on. And I'm sure we'll be getting queries from some of yourselves as well in terms of accessing those, which we will hopefully be able to support you on. Okay, so thank you all very much.